Here's a little self-care trick that I picked up in a seminar years ago. I used to use it in clinic all the time, and like every time I meet somebody and they don't, like I use it for that first time in front of them, they've never heard of it. But um, in physical therapy, we'll frequently mobilize joints, and that's a motion that the joint doesn't do naturally, but you can make it do. And this isn't like a chiropractic adjustment. This isn't like a thrust manipulation. This is just, kind of guiding a joint through a gentle motion. That's not what it normally does as part of its function. When you do that, you stretch the ligaments in ways that like kind of prepare them to be dislocated. And so they will relax muscles around the joint and they'll kind of dump pain relievers in there. So like if you have a stiff joint, a mobilization softens it up and it makes it feel better. And these are two hip mobilizations that like not many people know in my experience. So an anterior and a posterior hip mobilization. If you have a low back pain, it's worth trying this posterior hip mobilization. The anterior one isn't as common, but as a basic guideline, if something like in the hip or pelvis hurts in the back, try the posterior. If it hurts in the front, try the anterior. And you can do these yourself. Usually I do them for people, and that's a different setup, but y'all are physically informed individuals, so I can show you the self technique. So, posterior hip capsule mode. This is the hip that I want to work on in a quadruped stance. I'm going to take the hip that I'm not working on, extend it, and then like kind of go past center line. So this, I want to be at least 90 degrees and maybe even sit back on it a little bit so that it's like more acute in this direction. Go over here. So I'm setting this femur up at least 90 degrees, maybe a little bit more acute. And then you kind of find it like, oh, right there. It's like past center line and at least 90, maybe a little more acute, and then your body weight in there. You'll feel a stretch like right there in the back of your hip joint. And it's like the weirdest stretch. It's like something you've never felt before in your life. And you can just hang out here for as long as you like. You're not going to hurt yourself. It's a cool feeling, and it's a stretchy feeling. It's a little bit intense. And you can bounce on it a little bit, and you can kind of like wiggle on it. If you hang out there for 30 seconds or so and kind of play with the range, that really loosens up a tight hip. It's just so good. So then the anterior version, I'll show you this way. You're laying on your belly, and again, this is the hip that I want to train. So I'm going to put like a figure four back here. I'm going to drive this into the mat using like the knee and the ankle, this ankle, and my butt. There it is. Just a cool feeling of a stretch. Not quite like any stretch you've ever felt before. And it's good for loosening up a hip.